now that we're back to the business of educating children, when do you anticipate seeing RICAS or generic test results? And will there at least be a conversation given this year between you, the governor, and the legislature on things like vouchers or educational scholarship accounts?
So we will have the RICAS. We just finished administering the RICAS. We extended the window this year. We will have those scores available to the districts in the summer, and we will have those close to the beginning of the school year publicly available. We have not discussed anything else. We have just discussed getting the students the support and the help that they need looking at those scores.
All right, and the question, follow-up, South Kingstown, there was a great deal of controversy on multiple levels. You had the now statewide raging argument about critical race theory. You had the notion that a school superintendent would be involved in the dissemination of student addresses to the AFL-CIO for purposes of a mailer. That superintendent has been dismissed. What do you have to say about all of this mess that, and by the way, also there was the voluminous APRA requests that started this mess, the lack of communication between school districts. This is taking the state by storm, all of these issues. What are your comments on that?
Well, you said quite a few of them there. So in South Kingstown, I have spoken to the superintendent. I know that there has been a lack of communication, and I think that they have to work on that. That's at the local level. In terms of critical race theory, I think that there's a lack of understanding of what it actually is and what we're doing in our school systems. And the APRA, we follow the rules. If we get APRA, we follow the rules. But I think that there needs to be a dialogue so that we understand. We're talking about apples and oranges when we have these conversations. And I think that we cannot pretend like there isn't a movement that's happening on this topic.
To follow up, will the district at some point define what your definition is of CRT? Because that seems to be the single biggest issue is confusion over what it actually stands for and what it means.
I think we'll address it.
When can we expect to see that?
I don't know yet.
And given the fact that it's raging across the state, why don't we know that?
Well, because what they're looking at is local. Yes. So good morning, everyone. I'd like to start off by recognizing the governor for being an incredible partner in education and making our teachers a priority from day one. So thank you, Governor, for allowing this to happen. So I would also want to recognize Dr. Alexander Scott, the Director of Rhode Department of Health, as if everyone here doesn't know you. But she's been working night and day to make this day happen. So when we can announce that we're going to be fully in person come September, everyone fully in person. Districts will not be required to provide distance learning, which is a bit of a shift. This has been a really incredible year. As you all know, you've lived through it with us. But our teachers have risen to the occasion. Our nurses, our parents, our students, our principals, our superintendents, everyone in the education system, our bus drivers has gone above and beyond. When other states were trying to figure out how to create a calendar, we were already 10 steps ahead, and we intend to stay there. So our announcement today about being fully in person is really groundbreaking and really important for our system. So as we move forward, some of the things that will be different. Even though there will not be a requirement for distance learning, there will be some students that have medical issues or that when there are quarantines or illnesses, that districts have to have a plan for instruction happening through some sort of method electronically. Then there's also the ability to really look at those students that have medical issues that will work individually with the school district. The second piece that is really important for us is the busing. As you know, we struggled with getting our students on the busing. There is no longer going to be the mandate of the distancing of the numbers. So students, districts will be able to put the kids on the bus. However, masks will be required, continue to be required on the buses. Windows will be open. So that is a game changer for us. The other piece that is extremely for us will be that stable pods will continue to be utilized. And when not utilized, we will have 3 feet of distance is going to be recommended. We're also recommending that school districts create a mask policy for the students that are not yet vaccinated. As we know, vaccinations are only 12 and above, so any group that has not been vaccinated, there will have to be a policy within the school district. Teachers that have been vaccinated or students that have been vaccinated do not have to have the mask. So there will be a policy that each district will have. The LEA will be in charge of those policies that will be made clear to the community. So face coverings are required by federal law on the buses. I want to make that very clear because that has, the face coverings have been what we hear the most about. So we also are recommending that the LEAs adopt a 7-day testing quarantine requirement. What that means is that 7 days to quarantine and to come back have to have a test. So there has to be a test. However, the Department of Health has the discretion to have a longer quarantine if need be. Only close contacts with positive cases who are not vaccinated will be quarantined so long as adequate physical distancing was enforced. Longer quarantine lengths may be recommended in certain situations where there's more likely to be a sustained outbreak. We will continue to work in partnership with public health experts and the governor's office and the remarkable school leaders that have been doing this work. So today is an amazing day. We look forward to our kids being back in the school building and enjoying each other's company and learning the way that we know that our kids need in person with their teachers and in their environment with their colleagues. Dr. Alexander Scott.
Good morning. Thank you, Governor McKee. Thank you, Commissioner Infante-Green. And thank you both for your tremendous commitment to the health and safety of the students throughout Rhode Island. We know how critical in-person learning is to ensuring that all students in every zip code throughout the state have an opportunity to thrive, which is why the leadership you both have had and focus on this area has been so critical. I also want to acknowledge the teams at the Rhode Island Department of Education, the Rhode Island Department of Health, and our whole of government COVID-19 team that pulled together this thoughtful, science-based approach. And of course, along with what's been said, I have to acknowledge the families and school communities throughout Rhode Island for a year and a half of unprecedented partnership. Your flexibility, patience, and commitment have been the step that has made the difference. We're going to keep working with you and partnering with you to make sure we are ready for a healthy, safe, and productive academic year for all students. As the governor said, we had set the goal that we want to enjoy this summer. We are achieving that goal. We hope all of you are accomplishing that together. Our next goal now is to make it so that we can come in the fall full in person as we are discussing here. I only have the mask on at the beginning to be able to show for all of the adults. Being fully vaccinated by the time school starts means that you would not have to wear this indoors, and that makes a tremendous difference. Despite how well we're doing with COVID overall in Rhode Island, we need to remain vigilant. We know the numbers have gone down. We know that we're in a great place. The same thing happened during the summer last year. Our key is ensuring that everyone who is eligible gets vaccinated between now and the fall, so that when cases start to increase, we don't have to have the same type of increase that we had last year in the fall that everyone remembers. The Delta variant that is circulating globally is more contagious than any other strain of COVID-19 that we have seen to date. And the COVID-19 vaccine works to keep you protected from that. Given how much work we have done already on the vaccination front, it's not likely that we would see a significant spike as much as we did last fall. But the more people who are vaccinated, the better we will be, and anyone who is not vaccinated would be even more susceptible to getting infected. We want to avoid any increases or clusters of case counts anywhere in the state come the fall, because we actually have the tools to do that. The more people we have vaccinated, specifically, the more teachers, staff, and eligible students who are vaccinated, let's get to 100. There isn't any reason why we can't. The less likely it is that we'll see clusters of cases in schools or any type of disruption. We are going to be providing ongoing guidance, and should cases be identified once school starts, tailored recommendations and hands-on support on issues including quarantining, contact tracing, testing, and infection control will continue. As the Commissioner outlined so well, many of the public health measures that people have become familiar with will still be in place, such as distancing, symptom screening, and an emphasis on structured, stable groups, particularly among our students who are not yet eligible to be vaccinated. However, we are adjusting how these tools are implemented to reflect the reality in Rhode Island, that we are in a better place, and we want to continue to be there. Our reasons for making such progress is our vaccination program, as well as our testing program and the treatment that's been available. Number one message here, my standpoint that's important to relay, is vaccination is key. If you haven't been vaccinated yet, or a loved one, talk to them. Get access to what's available. The most powerful step that parents can take right now when it comes to COVID-19 is getting their kids, if they're eligible, 12 and older, vaccinated. When you look at the time interval required between doses, a student needs to get their first dose now to be fully vaccinated by the start of school. Now is the time. Let's make it that by July 4th, everyone you know, you love, you're aware of has received at least one vaccine, so that by the fall, everyone can be fully vaccinated. It's easier now than it ever has been to be vaccinated in Rhode Island. You no longer need an appointment to get vaccinated at most sites in Rhode Island. If you go to c19vaccineri.org, we've made our COVID-19 vaccine site locator the first thing that you see. You enter your address, then you get information and a map with the vaccination sites closest to you, including retail pharmacies, community clinics, hospitals, state-run and regional vaccination sites. You'll also be able to see what vaccines are available at every site. As a reminder, the Pfizer vaccine is the vaccine that children 12 and older can get. I'll wrap up by saying that Rhode Island schools, families, and students are going to have a great year. We're going to do our part by working closely over the next few weeks with schools to make sure that they are ready. Please do your part by getting vaccinated, getting your loved ones, your friends, your neighbors vaccinated, and making sure that the children in your life who are 12 and older are vaccinated too.